Hello everyone, I'm Dr. Monica, Assistant Professor from School of Pharmaceutical Sciences, Vistas. In this video, I'm going to discuss with you all about an overview of COPD. Regarding COPD, we'll be learning what is COPD and what are all the symptoms associated with it, etiological factors, how it can be diagnosed, what are all the treatment options available, and how it can be prevented. Chronic obstructive pulmonary disease is a term for lung and airway disease that restrict your breathing. People with COPD have airway inflammation and scarring, damage to the air sac in their lung or both. Emphysema and chronic bronchitis are both forms of COPD. Emphysema is a lung disease that results from damage to the walls of the alveoli in your lungs. A blockage, that is obstruction, may develop which trap air inside your lungs. If you have too much air trapped in your lungs, your chest may appear fuller or have a barrel chest appearance with fewer alveoli, less oxygen moves into your bloodstream. Pathological changes include alveoli or small, thin-walled, fragile air sac arranged in cluster at the end of the bronchial tubes, deep inside your lung. In a typical set of lungs, these are about 300 million alveoli. As you breathe in, inhale, the air travels through the bronchial tube until it reaches the alveoli. Once the air gets there, the alveoli stretch, draw in oxygen and transport oxygen to your blood. As you breathe out, that is exhale, your alveoli shrink and force carbon dioxide out of your body. Think of your lung as bubble wrap. The alveoli are like individual bubble in bubble wrap. If you have emphysema, your alveoli eventually break instead of many tiny bubble wrap bubbles. You develop a large air pocket like a big shipping air pillow. This damage causes your lung overall surface air to shrink and make it hard to get fresh air in and out of your lungs. This makes your breathing difficult and make you shortness of breath. Chronic bronchitis is a form of COPD where your lungs get inflamed and fill with mucus. The most common symptoms is a frequent cough that lasts for 2 years or longer. Chronic bronchitis never really goes away but can be managed with treatment. It is mostly caused by smoking. It is the inflammation of the airways, that is trachea, bronchi, or bronchioles in your lungs. People with chronic bronchitis have symptoms like cough and shortness of breath most days of the month, 3 months out of the year, or for 2 years or longer. It is commonly used to refer COPD, though people may still hear the term chronic bronchitis. It now more accurately called COPD. Let me tell you the difference between acute and chronic bronchitis. Acute bronchitis is usually caused by a virus like the common cold or the flu. It lasts only a few days or weeks. Whereas chronic bronchitis is when you get symptoms of bronchitis frequently for 2 years or longer. It usually caused by smoking or any other lung irritants. Symptoms of COPD such as shortness of breath, a cough that produces mucus, wheezing, fatigue, and regular chest infection. Other possible symptoms such as swelling in ankles, feet, or leg, anxiety or confusion, morning headache, cyanosis, and fever. Causes of COPD include smoking, alpha 1 antitrypsin deficiency, that is a genetic disorder that can lead to lung damage, secondhand smoke, toxin in the air, exposure to dust and fumes. How the COPD can be diagnosed? By checking the symptoms, spirometry, chest x-ray, medical history of the patient, blood test, and CT scan. Treatment of COPD include if the patient is smoking, he or she should stop smoking. Inhalers such as bronchodilators, that is long acting or short acting bronchodilators, pulmonary rehab. If the condition worsens, the patient should go for lung transplant. Management of COPD such as exercising regularly, keeping a healthy weight, breathing exercise, vaccination, and then nutritional support.